Good afternoon, everyone. Uh, Honored to present today's speaker. Today's speaker is someone many of us know very well, not just as a longtime Rotarian, but as someone who's helped shape this club and community for over 2 decades. Richard, our incoming president this July, is a 23-year Rotarian who truly embodies service above self. He's a retired pediatrician whose career included pediatric and neonatal intensive care, procedural sedation, and general pediatrics. Even now, he continues serving as a part-time Spanish medical interpreter because, as we know, and as Richard embodies, service does not retire. Richards is a husband, father of three, and a proud grandfather of 9. Born in Chicago, raised in Syracuse, and continuing to mature here in La Crosse for the past 38 years. Today, he'll share about the Lau Hospital, its mission, the care it provides, and the vision for a fully locally led medical team in the near future. Please join me in welcoming Richard Strauss.
Well, thanks, Travis, for the introduction, and good afternoon to everybody. Today, I'm going to be talking about Lao Friends Hospital for Children. This is a pediatric hospital in Luang Prabang, Laos, the northern part of Laos, and it serves to provide free, high-quality health care for children in northern Laos. And Nikki, let's see, what do I do to forward this? Oh, here, okay. Okay, thank you. How did we get to Lao Friends Hospital for Children? This is figuratively speaking, not literally, but Pam, my wife and I, we volunteered with Gunderson Global Partners for many years. We were in Matagalpa, Nicaragua. We were in Pine Ridge, South Dakota with Mark and Judy for many of these trips. And when it came around to 2017, Mark and Judy were volunteering in Laos, and they communicated with us and said, you two have to come here. And so we did that. It also coincided with the governmental suppression in Nicaragua, and we weren't able to go there anymore. We haven't been there in 8 years, and that's most unfortunate, but this was a great new opportunity. The last thing I have on here is, should I be doing this? It has to do with the 4-way test. Is it fair to all concerned? Is it beneficial to all concerned? And when I retired in 2018, I thought, okay, that's fine because I'm still working. I was working 2 weeks ago. But as the years have gone by and I'm farther removed from clinical medicine, those thoughts have been in my mind. Is it fair for me to do this? Is it beneficial? I won't answer that now. I'll go on, but I will try to answer it in a little bit. And I would like to thank Rob and Kari Ramzier and Nikki for making these slides better than they were. I had all the pictures, but I don't think you could have seen the pictures. So they enlarged them and made it much better. So thank you. I know I created headaches for you. What is Lao Friends Hospital for Children? Well, it's a 52-bed acute care hospital in Luang Prabang, which is a city of about 50,000 people. Some of the important things are that this is a free hospital. That is, no family, no child is turned away for lack of funds. Everybody is able to be seen there. This was created, and it's still operated by an organization called Friends Without a Border, and I'll speak a little bit more about that in a moment. And it's the only hospital in northern Laos that is dedicated to pediatric general care and specialty care. The history of this has to do with a man named Kenro Izu, who is a Japanese photographer. And he was in Cambodia 30 years ago, and he witnessed the death of a child whose family couldn't pay $2 for medicine. So this child died. And he said, this is something that should never have happened. It should never happen again. And he dedicated himself to trying to make sure that that would not happen again in Southeast Asia. And so in 1996, he formed this organization, started a children's hospital in Cambodia, and many years later, 20 years later, he started a Lao Friends Hospital for Children in Luang Prabang. His real mission was this statement here, that every child should be treated as if this is your own child, this is my own child. And the hospital extends his mission of free, quality healthcare in Southeast Asia. What is that mission? What is that vision? Well, Friends Without a Border and Lao Friends, they provide free, high quality health care in areas that really need it in Southeast Asia, promoting sustainable solutions to healthcare and believing that every child has the right to a happy and healthy life. And for me, and I think for them, the operative word in that last sentence is right. I think if you go back to that child who died in Cambodia, that was privileged care. That child's family had to pay money for the child to be cared for. And they, Kenro and the hospital, and I think all of us feel that healthcare is not a privilege, it's really a right. And that's what they're trying to do, is make it a right for children. Why does this matter? Well, there's because of distance and lack of access, those have huge effects on the quality of outcome, how people do. There are children and families we've seen who are coming from hours away walking. I think we've seen people coming from days away walking to get to this place. And if you take that long a time to get there to a place with definitive care, people will worsen from injury, from illness, and it makes for poorer outcomes. There are preventable illnesses there, there are preventable injuries, things like beriberi, malaria, pneumonia, diarrhea, and these all add to the very high under 5-year-old mortality. The other thing I think that's important is that we frequently say in pediatrics that children are not small adults uh, when we're talking about care. So maybe you know how to treat an adult. Is a child a small adult? No, not really. So Lao Friends, what they're doing is they're building a future where pediatric health care is being delivered by pediatric specialists, and in this case, by Lao individuals. What do we do there? So Mark and Judy and I, what do we do there and what don't we do there? Well, we consider ourselves experienced, and I think people looking at us would say, yeah, maybe you're experienced, but you are old. And I feel, well, you wait till you see the pictures of the people who work there, the Lao people. So, yeah, I'm old there, but we are mentors. We are partners, teachers, collaborators. We're friends. We give educational presentations. You can see that in the middle, and that's Mark and Dr. Mylor giving a radiologic presentation. We have demonstrations. So on the top, it's a pediatric surgeon from Florida. He's demonstrating how to place a suction device on an operative wound. It goes along with the kind of the motto of surgeons that you see one, you do one, and then you teach one. So the person on the left, Dr. V, he's a budding pediatric surgeon. He's helping. So he's seeing this one. He'll teach one, he'll do one, and then he will teach one. On the bottom, I think you'd see people going on rounds. So we're going on rounds trying to share our experience and our evidence based knowledge. One of the really important things I think about volunteering, especially with medical groups, is that there are a lot of groups that go somewhere and they go once and they don't go back. And well, that's great. They've accomplished a lot. But I think with Gunderson Global Partners, and I think with Lao Friends, we go back again and again and again. And so we form associations, long term relationships. And in fact, when I was talking to Judy this morning, she told me she just heard from Dr. Palm, who is the head of the ICU there, just talking about patients that they have seen since we left a month ago. Here are some pictures of the medical staff. There are 41 Lao doctors on staff. It used to be that there were a lot of volunteer doctors from North America, Australia, the United Kingdom, other places in the world. That's getting less common as there are more Lao doctors on staff. But there are 41. There are general doctors in general. So these are junior doctors, work there a year, 2 years, 3 years, you become a senior doctor. But a difference that we've seen over the past 10, 11 years is that well-trained, well-qualified doctors are now going for pediatric residency in the capital city of Vientiane. So they really are becoming certified pediatricians. It's not the same training that we have, but everybody has different training around the world. But this is really high quality training and very impressive. So when we were there, well, we didn't see 5, 6, 7, 8 of our friends because they're away for residency or further specialty training like radiology, pediatric surgery, hematology, and oncology. The doctors and most of the staff are multilingual. They speak at least Lao and English, and frequently Hmong and maybe another dialect, maybe Chinese, maybe Vietnamese. It is phenomenally impressive because we pretty much struggle to speak English properly. The other thing that strikes me, and maybe it strikes you, these people look really young because they are really young. They start their professional educations in general before we do. So these kids, so to speak, who are professionals, they could be my grandsons and granddaughters. It's really remarkable. The nursing staff, and it's really nurses, I mean, doctors are great, but I've always thought it's nurses who keep us alive, keep us going, especially in the hospital. There are 80 nurses caring for patients and families in the emergency department, inpatient department, the outpatient department, the peds and the neonatal ICU, and in the operating theater. Now, we always say operating room, but this is sort of British, that term, the operating theater. That's what people say there. And the nurses are bilingual at least. They speak English, they speak Lao. The idea behind the hospital was that because kind of the world operates in English, and as Mark and Judy were telling me before, the literature is, around the world, it's primarily in English. So a country of 8 million people, how do they stay up to date with medical literature? Well, it's English. There aren't really loud textbooks. So English is predominant. Well, not predominant, but it is present in the hospitals and it's present in the community, at least for tourism, commercial places. There are 33 allied healthcare personnel, and it's just like here. It's biomedical engineering, it's finance, it's the IT department, it's pharmacy, radiology. And a lot of these people have a couple of roles. The woman at the top right, Ko, I think she's one of the top people in the financial part of the hospital. But every day, well, many days of the week from 12 to 12:30, what did she do? She sat down with Judy and me, and she taught us the Lao that we can speak and maybe understand. So very sweet people. It gets back to what Regina said about being kind. Very kind people to accept these older, elderly foreigners into their medical center and community. Very, very, very sweet. What's the scale of impact of this hospital? I think it's really profound. As I've said a couple of times, the only provider of high care, high quality free care for children in northern Laos. They see over 45,000 children a year. That's more than 100 and something per day, and over 200,000 in the last 11 years. 52 hospital beds, 23 inpatient, 5 in the peds ICU, about 25 in the neonatal ICU, and over 200 employees. I guess maybe, I think it's accurate to say 199 of whom are Lao, and one, the hospital director, is Haitian, so is a non-Lao person. The peds ICU is relatively new, and that unit and the NICU provide care to the sickest, the most injured, the smallest patients. And interestingly, this baby on the left, this baby has measles. This baby's 3 months old, and I'm not sure if I can show you. I guess I can't touch the screen, but it's a video. But there's a new measles unit in the hospital, the adjacent hospital, the provincial hospital, because these kids need to be isolated.
Another baby, 3-month-old baby with measles. Let's see how rash is almost what we call harmful. It's almost just brain pain. Breathing hard. Or kind of sinking a little above the neck and the chest.
Measles is a miserable disease. If you look at that baby illustrates something that in medicine people call the work of breathing. Now, if you look around the room, I look around here, I see everybody has eyes open, pink lips. I don't notice that anybody's breathing, but of course you are breathing. But we notice that that baby's breathing, and we shouldn't, because that baby's working to breathe. So that baby is really miserable. I think this is a lesson for us. last time I saw somebody with measles, I was 5. It's when my brothers and I had measles. And that's been the case until the last few years. So this baby couldn't have been immunized, but if the community had been immunized up to, say, 95%, measles wouldn't circulate. It wouldn't be there for this baby. So I think we have a lesson to learn from people around the world.
Another baby, 3-month-old baby with measles.
Next one. Oh, do it again. Okay. Oh, sorry. So here's a picture of the pediatric intensive care unit. This is a 5-bed unit established 4 years ago. There are now mechanical ventilators, so breathing machines. There are no respiratory therapists. We have respiratory therapists, and I think it's a huge loss. I wish they had them. I'm going to try to show, maybe you could show the video of this baby on the left, and it illustrates something to me as well. This is a 3-month-old baby with pertussis or whooping cough. And that's okay if it doesn't play. Oh, is it coming on? Okay. So you can see this baby's working to breathe as well. Breathing about 100 times a minute. That's a lot. We breathe about 10 times a minute. This shows on the top left the oxygen saturation, 95%. That's pretty good. I had a debate with the pediatrician there. The pediatrician there said, I think we should put a breathing tube in this baby. And I said, I don't think we should put a breathing tube in this baby. I think she's compensating. So we debated that. And I finally said, you live here. You work here. This is your hospital. I'm a visitor. You have to do what you would do. And we ended up putting a breathing tube in that baby. The baby had the tube for 8 days, and then it was a real struggle to get the tube out. It takes me back to that idea of the 4-way test, and is it fair to all concerned? Is it beneficial? And I think the short answer is yes, because we were able to debate this. I didn't tell her what to do. That's not what we do. We don't tell people there what to do. We don't tell people what not to do. We are there as collaborators. And so that's what I was trying to do. The inpatient department has 25, 30 beds. It's in this big room, and then there's a corridor next to it for some preoperative, postoperative patients. You can see this looks pretty nice, but it's an open area. It's public. It is not private. So I can see what's going on there, but it's noisy. And you can imagine if somebody has an infection, well, you might catch it, and you might catch it because you're right next door. We're seeing patients with tuberculosis. We don't really see that here. Tetanus, don't see that either. Burns, bone, other infections, motor vehicle accidents, heart disease, and malignancies, cancer. This is a picture of the outpatient department that has 4 rooms for general and specialty care. And they see about 100 patients a day, kind of the usual, what we might see here. So colds, gastrointestinal infections, minor injuries, and what you would call the worried well. So a parent comes in and is worried, but I see the patient, I say, you know, your child looks great. I understand why you're worried, but your child doesn't have this. And then the unusual stuff like thalassemia, typhoid beriberi, which is a thiamine deficiency. And then after hours, children are seen in the emergency department. You don't have to be a pediatrician, a family physician to look at this child on the upper right. This is that look from 6 feet away from the door. And no matter what the story is this patient healthy or is this patient sick? What do you think? This patient looks healthy. This patient is happy. And usually a happy patient translates into a healthy patient. Not always, but I think you can see that the dad is also happy. And I think he's saying, well, I was worried. Now I'm not so worried. The NICU, this has space for about 15 to 20, 25 patients if they need it. But this is specialty care for the smallest, the most preterm babies, and the sickest full-term babies. Babies who need mechanical ventilation, a ventilator, will go to the PEDS ICU. And specialty services, there's a thalassemia clinic, a fracture clinic, there is a kidney clinic, developmental clinic for inpatients and outpatients, and outreach services providing these services to the community. Also doing a lot of teaching in outlying provincial and district hospitals, because if the level of care there can elevate, become better, that's where children are showing up and there aren't specialists there. So I think it's really important that that's been very effective. This place is 11 years old. They have growing pains. They had a high mortality rate in the PEDS ICU after it opened and after the ventilators were introduced. Before that, children would get to a level of illness, and because there were no ventilators or no ICU, what happened? Well, they got better or they died. And I think the expectation was when the PICU was established and ventilators were there, people would get better. But some of those children were just too sick to get better, and I'm not sure that was recognized. There's also a high rate of bone infections, and we don't see very much of that. I think a lot of that is due to malnutrition, an ongoing lack of service of supplies and laboratory supplies. That child who was intubated for 8 days, we did what was called blood gases, measuring carbon dioxide, oxygen in the blood, but they ran out of reagents for the machine. Couldn't do it. How do you take care of a patient like that? And Judy and I talked about it, and Jeff might understand this too. You get back to using your senses. You look at the patient, you say, how are you breathing? Can you be weaned from this? Are we going to get you up? No blood tests. It was very difficult, but successful. And then the persistence of what I would call automatic thinking. The picture on the lower left, that's the monitor for the ventilator. It's phenomenally complicated. The rule there is you go on a ventilator, and here's the pressure of the breath when you breathe in. Here's the pressure when it goes out. And I think people tend to use those numbers. And what I would try to say is, that's a great machine, but you need to look at the patient. If the patient's chest isn't moving, you don't hear anything, I don't care what the machine looks like. There are growing strengths, not just growing pains. More Lao doctors are going on to residencies, specialties, public health there. We've seen a huge impact on the effects of, or the presence of beriberi, the thiamine deficiency. The only non-Lao person there is now the hospital director. The huge emphasis on prevention, on education for families and healthcare people. And a year ago, the four of us established a reading program, a book donation program like Reach Out and Read, so that inpatients who typically they don't have anything to do and they're stuck in the hospital for days or weeks, at least they will have books, some sort of diversion. Luang Prabang, I'll just go very quickly, 50,000 people, the confluence of the Mekong and the Namkhan rivers. It's a UNESCO heritage site. It's a huge site for the history of Buddhism with more than 25 temples, young population, zillions of motorbikes, tuk-tuks, terrific markets, wonderful food. And interestingly, what time is it here? It's like 12:45 p.m. Thursday. It's 12:45 a.m. Friday there. So it's 12 hours difference, you know, across the world, making it a little bit difficult to get there and back. Lao is the national language. Like I said, English is heard in the hospitals. It's a beautiful language, a very tonal language. One thing that's interesting is when we ask a question, we use inflection, like, how are you? There's no inflection like that. So I would say, Jiao sabai di ba. That means you healthy not. And the response would be sabai di, I'm fine, or ba sabai, I'm not fine. Very tonal and pretty language. And you might have seen the scorpion. Pam and I saw, well, we saw a scorpion when we went on a trip to see elephants. My final thoughts. Every child has the right, not the privilege, but a right to a healthy, happy life. And this hospital is making a profound difference in the lives of patients and families in that part of the world after 11 years. I saw this sign not in Laos, but I was at Gunderson the other day. I looked up on the wall of the pediatric unit, and there it was. A child's life is like a piece of paper on which every person leaves a mark, and we hope those marks are good, leading to happy, healthy lives. Challenges there continue, poverty, distance, but I think there is less limited care, and there will be more specialty care. And then, Jiaomi Kamtam Ba, do you have any questions? And Kopjai Lai Lai, thank you very much.
Thank you, Richard. And we do not have time for questions today, but we do have a card for you from your club members, and we've made a donation to Polio Plus in your name as well. So thank you, Richard. And are you able to stay after a little bit if folks do have questions to come up? Great. Thanks again, Richard.